Hey, what's up guys? So shoulder mobility is something that's not often addressed, and it's one of the most crucial parts of recovery, whether you have an injury or whether you're just living a sedentary lifestyle of just sitting at a desk and not moving much, not exercising. Even if you are exercising and not stretching enough, you'll probably find that you have that forward head, rounded shoulders and bad posture because your shoulder locks up. So you can have conditions like thoracic outlet syndrome, you could have frozen shoulder, you could just have a limited range of motion, and when you trying to do a shoulder press or walk the dog and the dog pulls you in the wrong angle, you'll find that you cannot flex that way and you pull the chest muscle and you pull your shoulder and everything is just out of whack. So I'm going to show you a few simple things that you can do at home with a rubber band, and it's just going to get you bigger range of motion. You're going to feel a lot better and looser. You're not going to feel as tight when you're doing anything, and you're just going to feel so good after doing these stretches. So let's do it. Okay, so the first exercise is very basic. You're going to put your rubber band in the door, lock it in place securely or tie it around something and make sure it's very secure. And then you just want to place the band around your glenohumeral joint, which is your shoulder joint, right in the front, that ball and socket, which is just above the bicep. So place it here, and then from here what you want to do, you want to get some tension on the band, load it up, and then from here you want to rotate your arm across your chest, just pulling it slightly. Now while you're here, you want to roll away at the same time. So you're just creating enough pressure that you're rolling this way, the band is pulling you that way, and you're opening up that glenohumeral joint, and it's just loosening up. You're going to activate those stabilizing muscles and they're just going to loosen up. It's going to feel so good. You're going to feel so much more range of motion. So you're just going to load it up. Make sure that you relax everything here. Keep your arm up at an angle out from your body, up and out, so that it takes all the load off all the ligaments in the area. So you want to just put them across. Make sure you're far away enough. Roll a bit away if you're not. Put your arm across and then rotate upwards, roll away from the band. And just relax this arm and just feel how nice the band feels at opening up this joint. And you'll feel, as soon as you take the load off, it feels so loose. I mean, usually when you're tight, you can't even rotate your shoulder out to here. You probably lay like this and you can't get your shoulders down. So after doing this, you can see how loose everything feels. That's number one. Another great stretch we can do, also using the band, which is going to lengthen and stretch the pec minor, which is great and perfect for thoracic outlet syndrome. Your front delt, and it's going to give you that external rotation that you desperately need. We're going to grab the rubber band, lock it up, step forward, externally rotate the shoulder outward, and keep it behind you, and just step forward and just stretch. Now to add to the stretch, if that's too easy, simply twist, rotate outward, and you can feel it in your shoulder, your pec minor, and your scapula. Just gets that perfect stretch that you need. You can also change the angles with your neck if you need to. If not, just hold it here for a few seconds, play around with the angles. You can also lean a bit forward. Just feel what feels good, rotate a bit more if you need, or less, and that's going to just help with that external rotation and get you in that nice neutral position with your posture. Okay, this next stretch is good for your lats, because tight lats also affect your shoulder mobility. Tight lats can affect the way your shoulders round and pull forward as well, because your lats connect to the back of your arm and it connects all the way down to your pelvis. So it is a huge muscle and it's a strong muscle. So when those are tight, obviously everything's pulling forward, your shoulders are rounding forward and pulling a little bit tighter, and tight lats needs to be worked on. So this one, we're going to secure the rubber band onto something a little bit higher than us, putting the rubber band just above the elbow, and then from here, you want to externally rotate your hand, grab the band, and step forward. You want to keep it nice and tight next to your head, and you're going to feel that stretch in your serratus anterior, in your lat, and you're going to get that nice stretch in your shoulder blade. Now, from here you can work with the angles. you can stay in this stretch and you can twist your body and rotate it outwards, and you're going to feel that you're going to get a nice stretch in your scapula. It really feels like it's loosening up a lot, and you can just play around with these angles. Step forward, twist, just feel what feels good. You can also lower yourself and just get a nice stretch all the way down, and you're going to feel your mobility once you get out of the rubber band. You're going to feel the mobility in your shoulder. It feels so nice and you're nice and loose. So even if you're trying to get loose for doing a bench press or something where you're exercising and you're just feeling like you don't have that range of motion, this is a great stretch just to do before. You could do the first stretch as well, and you're going to feel that you can go into a much deeper bench press, a much deeper shoulder press. Everything just feels nice and loose. Okay, then finally, I want to do some foam rolling. Now, I finally got myself a foam roller. I've been wanting one for about 2 years and I've never ever got one. So, finally got myself one. Now, you don't need a massive one, you just need something small. I mean, you can carry this around with you, you can keep it in your car or just in your lounge. And this is perfect because it's not too hard, nice soft foam, but it's firm enough for you just to activate and roll out the muscles that you need rolling. So foam rolling is known with all the pro athletes and just to loosen up their muscles after intense training. But people with injuries as well, and physios, biokinetics, we all use foam rollers to help patients. And I'm going to show you what you can do today for thoracic spine and thoracic mobility, because we don't really pay attention to thoracic mobility until we have a problem and until we feel that roundedness. So your thoracic spine, you want to open up because of this forward posture, and we just want to get everything back. We want to get our spine in a neutral position, just extend it a bit and just open up the thoracic cavity. So as simple as this, we can lay down on it, have a quick nap if you want. You can place it just between your shoulder blades. Now, the common problem with people doing this, and I see it all the time, I've even seen other videos where people are showing foam rolling and they put their hands behind their neck to support it, and it just blocks off the thoracic spine completely because of your shoulder blades. So even though this is good to support your neck, you're not going to really target your thoracic spine at all because your shoulder blades are blocking it. So what you want to do is you want to crisscross and open up, almost give yourself a bear hug to open up that thoracic spine. And from here, you can simply lean back and roll. And you can actually feel that when you do this, most of the time, everything feels tight. You might even feel that your abs are extremely tight because your abs are so contracted from that forward posture that when you finally extend, it feels like all these abs are pulling and stretching extremely tight. So what you can do, either keep your arms out in front of you and just hit that thoracic spine, just extend it, or if you're struggling with that, just give yourself a bear hug and you can actually feel that you're hitting that spot, and you can just roll and extend, and it feels so good because you're just getting that neutral positioning of your spine, straightening it out instead of having it forward and bent, flattening out that spine, and it's going to help with your posture, with the rounded shoulders. It's going to take pressure off your thoracic area, your brachial plexus, and it's just going to open up your chest. You're going to breathe better, you're going to feel better, and it's something we all should be doing. Okay, so that's the video, guys. You don't need much of equipment, you don't need to get to a gym, you can do everything at home. All you need is a rubber band. You can get these bands at any local sports shop, and get one that's not too tight. The green one usually is like the medium band, the red band's usually the extremely hard and tight band, so you don't want to go too heavy. You want to find something that's just right, just to stretch you, even if you have to go to a lighter band just to begin with. Foam roller is not completely necessary in the beginning stages of recovery and stretching, but you can do things on here without much effort. You can just basically line the thing and roll up and down, and it's going to loosen up all those tight muscles. So if you're struggling with a ball in trigger point therapy, then I guess the foam roller is good for you. If not, just get a rubber band, because there's so many different things you can do with a rubber band. Besides recovery, you can do stretches and different exercises for a full body workout. And it's just simple things, just getting your body in tune, listen to your body, stretch, and I hope you feel better.